So we tell them the difference between normal thoughts and obsessions also. Even though we are saying that the person will have insight, लोगों को पता होगा कि ये कुछ abnormal चीज है जो हो रही है, abnormal thought है जो आ रहा है, most लोगों को insight होगी. But why do we have to get into this? Because they would still, having dealt with OCD for a long time, they would still have certain blurry lines between normal and abnormal. And even if they know, we have to reinforce this learning, we have to reestablish it. So we ask them, okay, why are we telling you to disregard these obsessions and not act on compulsions? Again, not right away, but why is treatment like that? So you have to ask yourself, do most people have these thoughts? So अगर हम example जो contamination का ही लें, the most common one, कि ask them क्या ज्यादातर लोगों को गंदा महसूस होता है टॉयलेट जाने के बाद? Do you always have these thoughts? Have you always had these thoughts? Meaning that क्या आपको भी हमेशा से ये thoughts आते थे? Did you always feel? तो आपको ये एक ही आंसर मिलेगा नहीं, because OCD would have developed at some point. बचपन से तो नहीं रहा होगा, right? Or like not ever since they can remember. There would be some point when it started. Is there any cause and effect between your thoughts and behaviors? Meaning that आपको गंदा फील हो रहा है, आप हाथ धो रहे हो, हाथ धो के क्या आपको बेटर फील हो रहा है? क्या आपको साफ फील हो रहा है? लॉन्ग टर्म में तो नहीं. तो कॉज एंड इफेक्ट क्या है आपके एक्शंस और थॉट के बीच में? कनेक्शन क्या है? कैन यू टेल अबाउट एनी अदर नॉर्मल थॉट्स दैट यू हैव? नॉर्मल नेगेटिव थॉट्स. तो नॉर्मल नेगेटिव थॉट्स वुड बी, हाँ जैसे मुझे अपनी बेटी की पढ़ाई की चिंता होती है, वो 10th स्टैंडर्ड में है, ओके. तो वो थॉट और ओसीडी के थॉट में डिफरेंस क्या है? When you probe, you will find they will say that हाँ ये थॉट बहुत ज्यादा एंजाइटी प्रोवोक करता है, मैं कुछ और नहीं कर पाती, कुछ और नहीं सोच पाती जब ये थॉट आता है. तो सो यू देन विल नो द डिफरेंस. एंड उसके साथ, इन थॉट्स के साथ ऐसे क्या इमोशंस और फिजिकल सेंसेशंस होते हैं जो आपको और किसी थॉट के साथ नहीं आते. सो फॉर एग्जाम्पल द एग्जाम्पल ऑफ दैट पेशेंट हु हैड इंट्रूसिव सेक्सुअल थॉट्स रिगार्डिंग हिज सन, he sometimes also had physiological sensations of arousal that he tends to feel very anxious about at the same time that he's having the impulse. So when asked this question, the last one, I ask him how he feels when he's actually aroused, when he is getting physically intimate with his wife, and he is able to recollect that yes, it feels very different. It doesn't feel anxiety provoking. It doesn't feel, he doesn't feel any guilt. And the physical sensation, there is no doubt that he's aroused. He knows that he's aroused. And that in contrast, they are able to differentiate, अच्छा तब ऐसा feel होता और अब ऐसा, so this can't be real. This is not real then. Right? So that is why it's important to do this differentiation with them, with these questions. And the next one. So this is the last slide we have, and after that we'll take questions for 10 minutes if anybody has them. So we explain this also. This is a very important thing. All of us have a self-preservation instinct. We want to avoid pain and we want to maximize pleasure. So when we feel the pain that obsessions bring, our natural instinct is to avoid them, because that's how we are made. That's how human beings are made. That is how we are wired. But unfortunately, when we avoid that, when we avoid the anxiety by those obsessions, we do that by performing compulsions, and they end up reinforcing our anxiety, reinforcing our obsessions. And why this problem is there? Because when man was created, what were the evolutionary dangers that were there? Wild animals, fire, catastrophe, fire, those kind of things. But those are not there anymore. Now we have started giving, now the same kind of stresses have been replaced by job stresses, relationship breakups, or even having obsessions. Now we respond the same way we would have responded if a wild animal had come in front of us to our obsessions. But that was a real physical threat in which we actually needed to run away, fight or flight from there. Either facility, when we avoid pain, we ended up performing compulsions, and the relief compulsions reinforces our obsessions. So that's a problem. And we just want you to see that problem now. We will tell you how to work through it. Right now, we just want you to understand this concept. Right, so with that, we end the first session.